We are going to jump in and get started. Thank you everybody for tuning in today. My name is Mallory and this is our first episode of Got Transition Radio in the new year of 2012. I am the Youth Program Manager for the Got Transition National Center on Healthcare Transition, which is funded through a cooperative agreement with HRSA and the Maternal Child Health Bureau. I am here with my co-host, Eileen Forlenza. For those tuning in for the first time, this radio program is for youth, families, and professionals who want to know more about youth transition to adult healthcare and be a part of what we're talking about. On today's episode, we're going to be discussing a question that we get asked a lot here at Got Transition, and that is, when is the right time to start talking about healthcare transition? Either as a young adult, a parent or caregiver, or a healthcare provider, you have probably been asked this in some capacity. On today's episode, we are hoping to have the opportunity to hear what people are saying, and you can share your own perspective of what has worked for you. We are awaiting our guest speaker today, Dr. Kirsten Hawkins from Georgetown University Hospital in Washington, D.C., and once she arrives, she will be sharing her thoughts and be able to answer your questions from a provider perspective. So before we jump in, I want to go through some housekeeping and remind you how you can be a part of this dialogue. On the webinar control panel on your screen, you'll notice the chat window at the bottom of the menu. You can use this or put your questions right into the window that says questions. Eileen and I will be able to see everything you write in both of these places, and we'll be able to respond and comment on them throughout the show. We will also be able to answer these questions and store them on our website so that you will be able to have that to share with others as a resource. So with that, let's get started. I know that within a lot of transition work that I've done and within my experiences, youth and families are really hearing the message of start early. And Eileen, why don't you get started with commenting on what are your thoughts on that? Has that been true for you, and what are some early steps that you took with your children, or what providers did with you that was helpful?
Well, great. Welcome, everybody. This is indeed our first Got Transition radio show for 2012, and also it's our 5th episode. So we have been expanding our listenership, and we're so excited to have you join us. And please take advantage of the opportunity to ask questions and chat with us during the 30 minutes that we have together. Yes, this question about when do you start is a question that comes up all the time. As a parent myself of 4 children, including a young woman with special health care needs, you know, we've been on this path for a while, and a couple of the shows ago, a couple of episodes back, I talked about my coaching my son Michael, who is now only in 8th grade, and helped him when he was in 6th grade about preparing for the doctor's visit, but also helping him to understand that this is part of him being a wise healthcare consumer. So, so right away I could just tell you that yes, it comes up all the time, this topic, and I have started with my kids generally around the framework of saying, you know, to be a wise healthcare consumer and for them to start being just more prepared in general. I start that in about 6th or 7th grade, so that's age 12, 11, 12 years old. So one of the other things that I've been doing with my daughter Holly, who has special healthcare needs, is, you know, it's a little different situation because she is nonverbal and she requires 24/7 care. She cannot manage her own health care, and she cannot direct a lot of the any of the conversation that we have with our providers. So my preparation then as a parent, again, starting fairly young, I would say we started right alongside the timeline that we were doing the transition care plan through her IEP, which was the plan that we have together at her school. And for those of you who don't know, the requirement nationally in terms of where does the buck stops here kind of thing. From a state mandate requirement, it's your Department of Education that is required to track the transition of students. Again, these are students with special health care needs. The Education Department is the department on the hot seat, basically, with really having to have a very strong and legitimate healthcare transition plan by the age of 16. That's federal law. And so that's about the time a student is a sophomore or a junior. So, so that was kind of a trigger for me at the time that Holly was in high school. She's 22 now. So it's been a couple of years. The federal law was actually age 14. So we started about ninth grade, making sure that Holly's transition planning was on track and that we were starting that process. So those were some of the early steps that I had taken with my typically developing kiddos. I frame it as being a wise healthcare consumer, and that goes along with their developmental phase of just having independence in general. And then with my daughter with special health care needs, I tacked it along with the IEP process, which was, again, about ninth grade or so. So I know that with a lot of this, the healthcare providers are the ones that I've often had to kind of pull along because they're not thinking about it until 18 or 19, which is generally the time that a pediatric practice will stop seeing a young person. So the providers that we've been working with on this project through Got Transition have really been open to learning this timetable a little bit more and understanding how important it is to integrate this into well child visits at those early, you know, again, middle school, high school time. So I hope that that's helpful. Mal, I don't know if this would be a good time then for you to maybe talk about, you know, excuse me, some of the process that you went through going through this yourself and some of your experiences.
Sure. Before we jump into that, Dr. Kirsten Hawkins is indeed on the line now. And so if it would be all right, I would love for you, Dr. Hawkins, to talk a little bit about what does your practice do in terms of preparing youth and families for that send-off to the adult model of care, and what are some things that you think families and youth can do to make sure that they feel prepared on their own in terms of resources or what has been helpful? And welcome.
Sure. Well, okay, thank you. I'm sorry that I was late, having some technical difficulties before. In any event, we're actually working with our parents fairly early on, and so by 12 to 14 now, trying to start talking about the eventual transition of care. And partly in that is that I practice adolescent medicine, and so I typically start seeing teens between the ages of 12 and 14. So I really try to address some of these issues at that first visit and talk about making eventual plans and having parents start to think about what things we can work on in the high school years as we start this transition to an adult model of care. And so trying to address it earlier rather than later. And some of the things that we do in our practice, one includes we talk about what our policy is regarding transition, when we will continue to see you through, how we will help facilitate any transfer of care. We talk about readiness assessment, and we actually have a paper assessment plan that we have the families and the patients complete at various times during their adolescence to get a gauge of where they are in the continuum of what things do they need to work on so that they can successfully navigate adult health care.
Excellent. Thank you so much. Could you comment a little bit on how that process might be managed differently when your patients have a higher level of support needs to be independent?
Sure. So some of the things that we talk about with the families, we mentioned early on trying to get a gauge of what level of comfort the families have and the youth have and their developmental abilities and capabilities. And we try to address that earlier so that we can see if there's any issues such as guardianship or medical proxy or decision-making that may need assistance, so that some of these things are addressed before the teens turn 18, and so that we don't have to involve a court system or kind of realize all of a sudden that we should have done this before.
Great. So going back to my experience a little bit, I think what was successful for me in my transition process, and what I encourage parents to be aware of, and that they have to come to terms with independence, is that magic number of 18, when everything changes in terms of eligibility and who is responsible for that care, whether the diagnosis changes or not. And so for me to really feel prepared to take over things at that point was really what I say is meet them where they're at. And as well as having providers understand that and maybe be open to why families or young people might not be ready to take certain steps. For example, in my life, my parents always sort of put it out there as an option for me to be involved in my care and to do things for myself. At doctor's appointments, they always asked if I had any questions and whether I wanted to, contribute to the conversation or those things. But it was never pushed or forced. And so for me, I was sort of able to go through the process and then recognize when I was ready. And I think, again, like we have talked about on previous episodes, is that a really important place to begin within transition is that really what you're doing is building a relationship with that provider. And I think as a young person, you may want to think about ways to become comfortable asking questions to your doctor, or even just having conversations about your life or, what's going on. And as we mentioned before, maybe practice that with someone that you trust, or someone at your school, to really get comfortable. So when you're in the doctor's office, you're not having that conversation for the first time.
I think just to add to that as well is that we talk about at our initial visits, we do a lot of what we call setting the stage, where we invest some time up front explaining how things are going to work, and that we're a little bit different in that we're going to start addressing the teens' needs and issues and asking a lot of the questions to the youth, and having the parents available for when there's questions that the youth don't feel comfortable or don't know the information. But then we say, well, next year I'm going to ask you the family medical history, and so that we start preparing them to be able to do so.
Excellent.
Yeah, this is Eileen. I just wanted to comment on that. I think that Dr. Hawkins brings up a great point, because the transition is preparing the parents as equally as it is the young person. There are, it's an obvious kind of typical flow, where sometimes, especially for parents who have kids that require a lot of care needs and care support, it's hard to let go. It's hard to not answer, and again, if you have a child who can't speak, that's not an option anyway, but there's a process that parents go through as well. And there's a process that, as Dr. Hawkins mentioned, when the practice begins to model that early on and begins really speaking directly to the young person, it helps the parent prepare themselves for the time when they won't be there to answer those questions, and to begin to rely on the support network that's around our kids. And I know that Dr. Hawkins could probably speak to what it's like when they have to let go, when that transition actually happens and they let go of that patient and hand them over to an adult practice. There's a whole process. That's why we call this transition. It takes time. And I don't know if you want to speak to that, Dr. Hawkins, about that process, what it's like for you guys on your end to be preparing to say goodbye to some of your patients.
For some patients it's easier, and for others that you spend a lot of time with, you may have a wonderful relationship with the family, it can be very challenging. But I think most of us in practice really work with the families and the youth, and making sure that they're happy in wherever they're going, and that we're still available if they need us. So for instance, I have a patient who's now being seen by an internist at another practice, but they'll still call me on occasion to say, hey, what do you think about this? And I generally am in agreement with the internist, but sometimes they just need a little bit of support from someone who's known them for a longer period of time.
Yeah, great. Thank you.
So we have a couple of questions about the resources that you were just discussing, Dr. Hawkins. And so I have put the links to those on the slide so that everyone has access to them. And I want to stress that these are what we have been using within our learning collaboratives, which is a method for different providers to get together in different sites and really talk about different strategies for transition and to test these as tools with families and youth in their practices. So we're sharing these as resources, but Dr. Hawkins, would you like to speak a little bit about what that experience has been like for you participating in that learning process?
Sure. So, for example, you see here the readiness assessment tools, and this is the baseline, rather generic version. And we've been constantly and continually tweaking ours, and that once we're actually using it and finding some things that didn't make sense, some things that were repetitive, some things that we thought needed to be addressed that weren't on there. And so we've been updating it. And so actually I think we're on our third or fourth version now of our assessment tool that we're using for our youth and families. And so each practice is going to have their own needs that they'll recognize once they start actually using it. And the other thing that we found very helpful was getting feedback from the youth and their parents and having them circle if there were words they didn't understand or questions they didn't get, that we could change things around, whether it was changing the grade level, appropriateness, or having a copy available in another language, and having that flexibility with the tool. And in terms of medical summaries, we have an electronic medical record where I practice. So I've been working with our IT folks on how to best create a medical summary so that we don't need to reinvent the wheel. We have all this wonderful data in our electronic record, but how do we pull out the data that we want to go with our youth? Whether they're transitioning to another practice or heading off to college, we want them to be able to take their medical history so they don't have to worry about not having all the details if they need them.
Excellent. Thank you so much. We also have another question about something that we have discussed in our learning collaboratives, and that is, Dr. Hawkins, do you have a formal written transition policy in your clinic?
We do. It's not exactly posted on the wall, but it's on our website, and it's available for our patients when they check in. We have a copy of it, and I've been trying to give it out in that first visit packet of information that they get so that they know when they're starting to see us that we will continue to see them through 21. If they choose to leave earlier, that's fine, but we're not going to abandon them. And then it kind of talks a little bit about how things change when a youth does turn 18 in terms of HIPAA and privacy laws.
Great, thank you. There's another question for you. They are rolling in. Do you work with internist adult practitioners to accept their patients? I hear from my constituents that there is a dearth of providers.
A dearth of internists available? Is that the question?
I'm not sure. It just says
I think
providers.
This is Eileen. The question is that as you are beginning to transition patients out of your practice, are you having trouble finding internists and other practitioners who will accept youth with complex healthcare needs, because there appears to be kind of a void in the system of having that connection happen smoothly for the patient?
Sure. I'm lucky enough in that I'm in a city where there are multiple university hospitals with university setting clinics, and then other participants in our learning collaborative. So I've gotten to know the internal medicine practice at another medical school in town, actually 2 different medical schools. And so we've now established links and connections so that if I have a patient that I want to transition, I actually have a provider that I can call and say, hey, can you see this patient? And so I haven't been presented with a lot of the difficulties I know that others might in other places in the country.
Great. I wanted to address one of the questions that has come up, and that was around the IEP process. The question actually reads, you mentioned early in the broadcast that transition is part of the IDEA legislation. What would you expect to see written into a student's IEP? That is a great question. The transition process that is part of the IEP really talks about how successful will the student be in independent living, so housing, employment, and self-care and education, or just self-care and their ability to live independently. So in the IEP, I recommend that you talk a lot about the different specialists that are part of the young person's medical home team, and that what is being put into place when the student leaves the school system, that will be maintained in the community system. And what I mean by that is that because of the IDEA legislation that mandates that the school is responsible for some supportive services such as therapies, speech therapy, for example, access to the community, then in the health part of the transition plan, there should be indication in there about how are medications going to be maintained, how are therapies going to be maintained, and oftentimes the primary care provider or a specialist will attend even by phone or another way just to have input into these IEP meetings when they're talking about transition. So I can go into that a little bit more in depth. We're thinking about actually having a show dedicated only to the IEP process and working with schools. So thank you for asking that question, and we'll be certain to give more information on that.
And just a comment, Dr. Hawkins here, and that sometimes families are surprised when I ask about getting a copy of the IEP or being involved, and they think that the IEP is really just for school and education purposes. But there are a whole host of information that is important for how we care for our patients that are so valuable for us. And so when we ask for IEPs, it's in our best interest and their family's best interest to provide them so that we can make sure that the youth are getting the correct services that they need, that we feel they need. And sometimes the IEPs will be enlightening for us. We'll learn information that we didn't necessarily know about.
That's great. Thank you, Dr. Hawkins, for adding that.
There are just a couple more questions that I would love to get to. This is wonderful. We have never had this many questions rolling in. Such a great turnout for this episode. We are unfortunately running out of time, so we'll try to get in a couple more. Eileen and Dr. Hawkins, what ways are parents and physicians, working for adolescents that are nonverbal and have cognitive disability and severe medical conditions, and how can parents help in this process?
Wow, well, that's a great question. Thank you for asking. As a parent of a child with significant, cognitive disabilities, and Holly's nonverbal, as I've shared before, I think what's important is the partnership. I think it's really important for the parent or other caregivers to have a vision for what do you want your child's life to look like 10 years from now. So I'm saying whatever that point is, when they're 25 or 35, what do you see with that? Are they living with you? Are they living in a group home? Are they living with family, relatives? Do they have support? What does that look like? And that's the kind of vision that I think is important for a parent to share with the providers, so that we're all creating a treatment or a healthcare plan that is consistent with what our life goals are for our child. I don't know, Dr. Hawkins, would you like to respond to that as well?
I think you summarized it very well, and sometimes I've found where I may not be the first one to address the concern, but sometimes the families are surprised when we're asking, and it's interesting that we're trying to think about the best interest of the youth and trying to make plans for the future, and that sometimes the unexpected happens, and there may not be a family member who's available to step up to the plate to help care for the youth, and what do we do in that situation?
Wonderful. Thank you so much. And that again is such a great question, and again that is something else we could probably just do a whole episode about. There's so much to share in terms of that. The last question I'm going to answer, and it's, how did your parents and educators encourage you to develop self-advocacy and self-determination, also sharing about your specific needs or disabilities with various audiences? And I kind of joke that I have always been a self-advocate from the time that I could talk, looking back, because my parents were very adamant about me just being aware of the things that were a part of my life and a part of who I was. And my diagnosis is a digestive illness, and so when I was younger, I would always do presentations in my school to my classmates and my teachers, and when we were in the younger grades, it started off, explaining that I didn't eat the same way and that my tummy was broken and all of these things. And then as I got older, I kept presenting to my class, but in a different way so that they would still be engaged. Like, for example, when we were in high school, I started talking more about the biological aspects of it and what it really meant and how I got my nutrition versus how they did. And although they had been hearing this, every year growing up, there were still new class members, new teachers, and they were learning different things about it. And in doing this in such an educational, inclusive way, just to really put it out there, I really think that had a huge impact on building my system of support, because my class was probably the tightest I have ever seen to date in terms of education and peers and all of that. And so, they really just helped me to accept what I had and who I was, and just to share that as if I were saying, hi, my name is Mallory, my favorite color is pink. To me, it wasn't a big additional deal. It was sort of just who I was. So I think that was really helpful to me, and really I started giving presentations when I was in kindergarten, I guess. But yeah, so I really just encourage parents and educators to build in that acceptance and that self-awareness as just, this is who you are, and that's okay.
That's a great point, Mallory, and if I could just bring this, I'd like to make a comment to that too, because I applaud you for always being so open and sharing your journey with your community so they could learn along the way. I think that that's courageous, and that's a big part of shared learning, and it's reciprocal learning, there's no question. And I want to add to that as well, from the parent perspective, going through the IEP process and care planning with Medicaid, all the things that I've gone through with Holly, my other kids were alongside every one of those meetings. And so building that community support within my own family so that Holly knows that her sister Emily and her brothers Cody and Michael, that they're aware of this, and that Holly's part of the family, and this is what family does. And so most of our big IEP meetings, and then as we transitioned out of the high school and into the community-based system, we did that as a family in this very same way, Mallory, that you're discussing, that, again, because Holly can't speak for herself, we wanted to have the voice of family, and we wanted our community and health partners to know that we were taking this transition very seriously as a family, and that Holly will have these supports the rest of her life. And it may not always be me, it may be her brothers and sisters, but we as a family are committed to a successful transition into the community. And so I just wanted to bring that up, that there are ways that families also can self-advocate, if you will, for their nonverbal child in a way that shows commitment, dedication, and a vision for the future. And I think we can talk about that more even on another radio show if that's helpful to others. So, but it starts with exactly what you said, Mallory, that you are a self-advocate, you have been comfortable in your own skin, and you have been talking about your condition at developmental stages your whole life. And so, this radio show is a platform that's kind of natural for you. And other people don't always have those same skill sets, but that's because it hasn't been taught. And I think that in some cases, it's really a matter about giving people the toolkit that they need to do that kind of self-advocacy.
Great. So unfortunately, we are just about out of time, so I want to wrap up and give a huge thanks to Dr. Hawkins. We know that she has a very busy schedule, and it meant so much for her to be here today. Thank you.
Well, thank you for the invitation.
And also just a special thanks to all the providers who are working on the issues of healthcare transition and who really have a passion for making that happen in a successful, fulfilling way. So with that, I would really like to encourage you guys to keep this conversation going. Stay tuned in what we are doing. The slides and resources from this episode will be on our website. You can like us on Facebook, follow us on Twitter. All the links are right there. And again, these questions will be saved and archived and answered in a more complete form and saved on our website. You can also listen to past episodes of Got Transition Radio either on our website under broadcasts or subscribe as a podcast on iTunes, which I still think is so very cool. Just go to the iTunes store and search Got Transition. You can also register for our next episode, which, as we said, is going to be about the IEP process and incorporating health goals into that. So feel free to register for that today. That is going to be on February 22nd at 3 o'clock Eastern Time. And with that, I would just love to thank everybody for tuning in. We've had some amazing conversation, and we have so many great people out there doing work around transition. Eileen, do you have any final thoughts?
No, just thanking everyone again for keeping this discussion alive and robust. It matters to families. This show is intended to address real issues with real families, with real concerns, and I think we've done that again today.
Thank you so much. And with that, I will just remind you, every transition is unique, just like you, and we will talk to you next month.
Thank you.
Thanks, everybody.